Marsha Katz on Disability Policy, Part 4, The Trap of SSI.
When people are on SSI, right now, the way the rules are set up, they're almost set up to keep people from lifting themselves out of poverty. I mean, you can, the asset limit has been $2,000 for, I don't know, 30 years or something, over 20 years anyway. And so people aren't allowed to save to be able to lift themselves out of poverty. If you're on Social Security disability, if you earn over certain levels, then they automatically will cut you off at a certain point. And so people aren't able to lift themselves out of poverty, and yet there are, for people who are on TANF and ABC, there are a lot of states who have changed those rules so that people can in fact save money to buy a home, who can save money to have an education or to start a business or something, so that they can lift themselves out of poverty and not be receiving that money. And when you're on SSI, the more you earn, the less SSI you get. You still end up ahead by working, but that's fewer dollars that are coming out of the general fund for the SSI benefits. And so, you know, it doesn't make any sense to have people in a situation where they can work a typical job and get health insurance, but then they can't save any of that money to buy the things that the rest of us try to save money for. There is I think on the Nickel website, there may be some things about this in terms of the National Council on Independent Living's positions on some of these issues, and the National Council on Disability too, I think, has done some reports on this. So those are both places that if you wanted to look more at some in-depth, and actually I think the National Council on Disability is in the process of doing another report right now that may include this, I'm not sure, but it's on Social Security and SSI. And people are really advocating for higher benefits because the benefits now are so low, and they do pretty much force you to live in poverty, to not be able to lift yourself out of poverty, and to have to depend on other programs when you could potentially be at least working somewhat to be able to help support yourself more. Have more of your support coming from the dint of your own effort.
The importance of Medicaid.
That would be qualifying for Medicaid, whether that's for covering healthcare costs, or Medicaid right now is the only program. I mean, you could get the best job in the world and you're not going to have health insurance that covers personal care attendants, personal assistants. And so Medicaid is the only thing right now that covers that. And so that becomes essential. I mean, there was a few years back, actually, during the Clinton administration, we met a U.S. attorney in Washington, D.C. She worked in the San Diego office of the U.S. Attorney's Office. She was a quad, and she spent so much money on personal assistance out of her own pocket because of the salary that she made, that she qualified for HUD subsidized housing and food stamps. Mm-hmm. And so she worked with the federal government. The federal government's insurance doesn't cover for personal assistance. There's certainly, Medicaid is, and so the Medicaid laws are different. And the Medicaid laws, actually, it's not even just, there are, there is on the books, and I think states that weren't doing this are being forced to do it, where if somebody used Medicaid and then they die, their house can be recovered by the state in order to pay for the cost of the Medicaid.
Marriage and SSDI.
For somebody who, if you receive Social Security disability and you get that because you're what Social Security calls a disabled adult child, meaning that you have a disability that began before you were 22, and your parent has either died or retired or themselves become disabled, and they start receiving their own benefits, either their own retirement benefits or their own disability benefits. If you're an adult child over the age of 22 and your disability started before then, you're actually over the age of 18 and your disability started before you were 22, then you can be eligible to receive benefits on your parent's account, and those are called disabled adult children benefits. If you get married to anybody other than someone who also receives that same kind of a benefit, so if you get married to somebody, for instance, who has a job, your benefits get totally cut off. They're not reduced, they're just totally cut off. And so you totally lose your eligibility for that. And if your spouse is working, then you also very likely might not be financially eligible for SSI. And all of that, then, so you may not have any income at all. And your spouse may then be the sole support of both of you.